Hey everyone, so we're going to start a little something new moving forward for our Family First with Fox 43 segment. I'm Matt Maisel, bringing you these family segments every week. And once a month, once every couple of weeks, we'll see how it goes. We're going to go deeper into these conversations because we're hearing from you that this is something that you want more of. There's a lot going on in the world right now and a lot that's hard to fit into a small story. So thankfully, we have this platform where we can go deeper into some topics. And we're going to start that today, talking about a lot of the socio-political topics and issues that we're seeing with a lot of the debates that are happening right now with parents and school boards and things of that nature. Things are getting pretty heated out there, and the impact that that is having on area youth. And joining us now to talk about this and so much more is a good friend of ours here at Family First. He's the Medical Director of Psychiatric Services at Wellspan Ephrata Community Hospital, Dr. J.P. Shand. Sir, thank you so much for taking the time for us today on this new Family First with Fox 43 venture. I don't even know what to call it yet.
Well, thank you very much for having me, Matt.
Yeah, I'm kicking around dads and docs. I don't know, because you're a dad as well. We're gonna have other people on as well. Both of us are dads, and I think that's why whenever we have these conversations, it kind of goes into this area where we really kind of touch on a nerve where both of us can kind of relate to. When you see what's happening right now with a lot of the kids, you're obviously involved seeing them in a hospital setting for mental health related issues. What are you seeing right now?
We're seeing a lot, pretty much all of it, Matt. I got to be honest. There is everything from behaviors that are worsening in terms of emotional regulation, aggression. There are things that we can see with distress tolerance, meaning that kids are having a little bit more difficulty tolerating distress and change. We're seeing increases in anxiety and well, I'd say increases in depression, obviously, as well, which often go hand in hand.
Are there more kids in the hospital now than, I mean, obviously you're not dealing with, from the medical perspective of COVID, positive patients necessarily, but you're dealing more with the mental health side of things. But are you seeing more kids there now than maybe you were before?
Yes, very much so, Matt. In fact, we had some statistics looking back at our ER visits, and it has increased to a point where it's almost doubled the number of cases that we've seen this year compared to years previous. And obviously that can be due to many factors, but I'm sure some of this period of instability, unpredictability, things that kids really rely on, has certainly started to disrupt some routines that children do rely on to feel stable and safe and practice their own coping skills and their ability to tolerate the stresses of being a child.
You mentioned routines. It's such a buzzword in my family because we have a 4.5-year-old and a 1.5-year-old. You know this from all the times that we've talked, but everything we hear when we're dealing with kind of our struggles is, are they in a routine? Get them in a nighttime routine, get them in a daily routine. They're obviously toddlers. What you're saying is teens, older kids need these routines as well. And when those routines are thusly impacted, it could lead to pretty negative situations.
Big time. It's funny, our pediatrician says the same thing, and my wife heeds the routines better than I do, maybe. But she really is the staple in the house. I would say that the entire lifespan, Matt, requires these routines. I actually just had an elderly individual in my hospital here who said that, the pandemic and access to going into the nursing homes and places that she used to volunteer and spend time was disrupted. And her sense of value and self-worth started to deplete as she had less and less access to her own outlets for what made her really feel fulfilled. So you're right, you can see that then subsequently in the teenage population. But as you and I know, as fathers of very young children, that is where these routines begin. and humans are always reliant on predictability. We want to know what to expect. And that's one of the things that humans do above any other mammals, is that we have this ability to look into the future and know future outcomes. And when we start to not have that ability, it increases cortisol levels and stress. And if we don't have the system in place to handle that stress, things can start to get out of control.
What are you hearing from kids? I know that you can't, we're not asking you to name names or anything like that because, listen, privacy, HIPAA, we get it. But what are some of the issues that you're hearing from kids when you talk to children, when you see them at Wellspan Ephrata? What are their big concerns right now?
Yeah, it's probably, like I said, across the gamut. One of the things that stuck out to me recently, though, was there have been a few individuals who have really hit this home with me, that this idea that they were doing better in the virtual environment than in the school environment, and some kids that were saying they were doing better in the school environment than the virtual environment, and that when they lost one or the other, it created a real ripple throughout their life. Their abilities to studies went down, their grades dropped, their interpersonal relationships struggled, friend outlets were changed. So I really kind of looked at medicine, that we have been able to adapt very quickly in terms of virtual visits, something that was relatively unheard of previously, that virtual visits were very rare. And now during the pandemic, they've increased substantially. And really the system has responded to the need. It made me wonder if there is some possibility that school systems in the future could start to respond to individuals' needs. These kids who do better in the virtual setting could stay virtual. Kids who do better in the in-person setting go to the in-person. It just
we see that now. I mean, we depending on, not every school district has that available, but a lot of school districts are instituting their own cyber academies.
Yes, which is wonderful.
Right. Okay, so that's something that, from what you've seen from talking to kids, that's something that you as a medical professional, psychiatrist, see as something that absolutely has worked.
It's really impacted these individuals' ability to adapt to an ever-changing environment. And some of these kids are really finding that some of their more social issues went away, during some of the pandemic. People who felt very bullied or overwhelmed at school, high anxiety individuals, actually had some of that quelled. So, the real thing that stuck out to me was that sometimes these periods of extremes can actually uncover other social issues and mental health issues in my arena that were underlying this, and that we could actually be a little more adapting or able to adapt to. So that's something that stuck out to me as one of these, well, I'm always looking for the silver linings, Matt, as you know, and this may be one of them, that we may be able to respond better to these kids who are not feeling very empowered in their settings, but now have an opportunity to maybe be a little more so.
How do you deal with, and maybe I'm getting a little off topic, and if that's the case, we'll bring it back eventually. I'm just wondering, you as a psychiatrist, it's your job to get in the minds of other people. So now I'm trying to get in your mind as a psychiatrist. How do you deal with the delicate balance of what you said, finding the silver lining, which is something that I try to do a lot of, versus just being deeply empathetic, and when someone is kind of deep in the mud, they want others to feel deep in the mud with them?
Yeah, there's a term for that too, in terms of, bringing other people down. One of the, I guess to answer your question is,
I don't want to make it sound like, bringing other people down, but wanting other people to the only way someone else is going to understand how I feel in this moment of deep depression is by being here kind of in the proverbial foxhole with me. I don't want to bring you down and make you feel worse. I just want you to understand and listen to me that, hey, I'm feeling like crap right now. I need you to not give me the silver lining necessarily, as much as I want you to truly kind of feel this deepness and darkness that I'm going through.
Yeah. guess your question is, how do I navigate that?
That balance, because there is a place for the silver lining, but I also feel I'm not a doctor, but I also feel from my own experience, sometimes I just want if I'm having a bad day, I want someone to be like, yeah, man, it really stinks.
That you hit on
I
something
feel ya.
really, really important, actually, that I try to talk about a lot too, that this idea that if I, let's say, come to you, Matt, and I say, hey, I'm really struggling. I'm feeling depressed. I'm feeling anxious. I don't know how to handle this. A majority of the time, the other individual's response will be, hey, it's not that bad. Look at all the great things you have going for you, A, B, C, and D. And
Right.
look, you really have nothing to be sad about. Your life is great. Really, can't you see that?
And
That
sometimes you
actually
hate
makes the individual feel worse, because it will make that person feel more isolated and lonely and be like, wow, you're right. I don't have anything to be sad about or upset about or anxious about, and I still feel this way, which makes you actually further removed. Those ideas of, well, pull yourself up by your bootstraps, just get over it, go outside. Those things aren't possible with individuals who are actually suffering with chemical imbalances, which is our understanding of how depression and anxiety works. So you're right. If I or somebody else who this individual who may be depressed or anxious go to can try to use that empathy side of them, tell me more. Why do you think you're feeling that way? What do you think would make it better? How can I help you? Those are the responses that you're really going to want to target, to get that person to feel that you are interested in them, not just what is actually you making yourself feel better. So if I come to you and you say, look at all these things you should feel great about, both of us walk away from each other. Who feels good from that? You do. Because you said, well, I made him feel great. Look at all the things I told him about, and really, I don't feel
not so fast.
So, yeah.
All right, we went off a little bit of an extra ramp. I want to get back on the highway with the importance of the impacts that what we're seeing now, that schools are fully open, and the impacts that they're having on kids. And one of the things that I kind of look at as this, you see a lot with parents, and I don't want to point the finger at parents necessarily, but how much do you see as the impact that parents are having on the way their children ultimately feel? The ones that you see, the impacts that the parents have on why they're there in the first place.
I don't even think that I can stress enough the impact that parents have on their children. Even if parents are thinking, well, she doesn't listen to me, they are listening, and they are a sponge for everything that you're doing. Every response that a parent makes to an outside stressor, that child is looking at that response, identifying that is working to a certain degree for that parent, and they are internalizing that. And then you're going to see some of these behaviors, in your child. So really, we have to be so careful as parents as to how we respond to things in front of our kids, because they are so attentive. Everybody makes the joke, that they never knew when they turned into their parent. I see myself doing it all the time. Like, oh my gosh, that's something that my father would say. You never see it, but this is also a lifespan. I want to say something that you grow into through the entire lifespan, that you will find that your children are following right in your footsteps behind you.
One of the things that I've noticed in our coverage of all these school board meetings that happened before school started, after school started, the focus being on should kids wear masks in schools and things like that. You hear all the time from parents, not necessarily kids, or never. We've heard majority from parents, and a lot of the parents have been very angry. What type of impact do you think that has on their children?
Probably a very distressing one, because when kids get mixed messages from their peers, from their teachers, from their school board, from the CDC, and from their parents, they're trying to synthesize all of that information and please everybody. I will say that in a majority of cases, kids went many cases, the path of least resistance. and parents have such an impact on kids. So if the parents are telling them one thing and their teachers are telling them another, or their peers are telling them a third thing, they're really going to have increased anxiety and distress around the idea of, well, who do I listen to? And it's very hard to say, where they will ultimately fall in that decision-making process. But I think the best thing that a parent could do is help the kid make decisions for themselves independently and feel empowered in their own decision-making process, instead of trying to force one's own belief system onto their child, helping them think through it independently and gain a sense of rational thought process. That is probably one of the biggest gifts that you can give to your kid.
Is that something you're seeing a lot with the kids that you talk to?
I think that there is a lot of impact on this unsettled experience that parents are, in the house. I've seen many of this yelling at the TV or being very, very upset and totally perturbed and emotionally dysregulated due to governments or CDCs or different guidelines changing. And that is really jarring for the child, at any age, to be honest, seeing their parent in that kind of distress.
So like as a parent then, if a parent's watching this and is basically has this moment of realization of, oh, wait, that's me. What's the best thing to do? Is it to turn off the TV, or is it to just kind of do a better job talking to your kid? I don't want to come off as parent-splaining to someone, and I don't want this to be something like parent-splaining. But what are better practices for parents when it comes to dealing with the delicate mindset of a child or a teen?
It's a great question. I think stability and predictability in that environment as well is tremendous. So if you find yourself being completely riled up by newscasts at night and your kid is doing his homework in the next room and you find yourself, getting upset and, demonstrating that out loud, that is going to be tremendously disruptive to that individual who is trying to actually focus somewhere else, right? Or tolerate something that is stressful for them, often homework, or projects or whatever the kids are doing. So if you could actually encapsulate those things and identify your own emotion and say, I'm going to have an outlet for this emotion at this time, and kind of segregate these experiences, because everyone has them, right? We know that everyone has these experiences. I'm not going to say turn the TV off and just ignore it and take a total hiatus. Those things aren't really possible. But if you find yourself getting worked up, there are two options. One, you just remove that thing from your life, or two, you try to isolate that and utilize those experiences in some kind of a cathartic way, or letting out that emotion in a place where it's a little bit safer and you don't feel like you're affecting the children.
So one of the first things you mentioned is that caseloads, hospital visits double what you have seen of late. How does that get fixed?
It's a really good question. One of the things I think, well, there's a few answers to that. One of the things I think would be the most impactful, though, is if we could get resources in the community to help reduce the need for the highest level of care. So a lot of times, some of these warning signs, of anxiety, of distress intolerance, then of kind of emotional dysregulation, can be nipped in the bud down below here before it gets to this point where it escalates and it requires what we consider in psychiatry the highest level of care, which is inpatient treatment. That is always wanting to be avoided as best possible, which means that we're doing a good job in the community helping with the needs and the emotional needs of individuals at that level outside.
What does that take? More money?
It will probably take more attention, more people to be able to provide the services. As we know, the system was taxed already. The mental health system, especially for children, child and adolescents, was already taxed pre-pandemic, and now it is overloaded.
And we've talked about how taxed it was. Give us a sense of someone who's just tuning in and partaking in our conversation for the first time, just how taxed is the mental health profession right now?
So I know that initially when I was talking to my pediatrician friends, they would say that they were waiting 2 to 6 months to get in to see a psychiatrist in the county. And that was pre-pandemic, yes.
Pre-pandemic.
And yes. And now I've seen wait times, I mean, to the point where wait lists have even been done away with, because the wait lists were getting so exorbitantly long that we're actually triaging in a different way now.
Is that the difference? Like, I don't want to put words in your mouth, but when you're talking about kind of how much more serious mental health related issues have gotten because of the pandemic, is that like a matter of, I don't mean to go super, take it there, but is that a matter of life and death in some instances?
Of course, in some instances, indeed. Now, there are some great community resources. There's a crisis intervention center. There are some resources that can act quickly in those emergency situations. Wellspan has been doing a tremendous job of triaging and also, putting in a hierarchy. We use that term in medicine, triaging, putting in a hierarchy those who are at the most need, and also getting access to individuals both virtually in their own homes for therapy and mental health, and also allowing this new program, which is called shared care, which is where primary care doctors can send their, and pediatricians can send their patients to a psychiatrist who will see them for a few occasions, get them set up with the treatment regimen and back to their PCP, which will also reduce demand. So we're trying to be very adaptive.
If someone's watching this and it hit a nerve, and we hope that by doing this, we're hitting at least some nerves for people to take action, whether it's you need help or you want to help. If someone falls into one of those categories, what's the next step? Who do you talk to? Be it someone from Wellspan or if there's another outlet that would be good for mental health resources.
Yeah, I would say early intervention is key. So at the first signs of some of this distress, don't ignore it. Talk to your children about it. Try to understand where this is coming from. Then the very first resource will probably be your pediatrician. Your pediatrician can start to make those connections very early on and get you on wait lists before things get too bad. And then I would say, now that is all outpatient, if things reach the level of it is life or death, as you said, if there is a serious concern for an individual's safety, yourselves, your children's, I would call the crisis hotline. There is a crisis number and they can help navigate the emergency resources needed at that time. And then of course, getting to the local ER as quickly as possible if that is the case.
This has been a wonderful, enlightening, necessary conversation, Dr. Shand, and hope to do many more with you, because I know this just kind of is the tip of the iceberg on some of the issues that you deal with every day and some of the patients that you see. Appreciate your time and appreciate what you're doing on the regular with your patients at Wellspan Ephrata Community Hospital. Dr. J.P. Shand, Medical Director of Psychiatric Services at Wellspan Ephrata. Thank you so much, sir.
Well, thank you, Matt. And I just want to actually throw that back to you for getting this information out to the community, and your segments have really been tremendous. And it's very honorable for you to allow people to be able to access this information.
And hopefully we could do more. Hopefully this is just the start.
I'm looking forward to it.
Episode 1. So thanks again.
Thank you, Matt.